Mr. Smith? Mr. Smith, help, he's unresponsive.
Everything that Benner said in her book, Educating Nurses, is true. As they get into the scenario, they go in worrying about themselves.
Let's get the board underneath him.
Worried about being on camera. Am I going to mess up? Am I going to look silly in front of my peers?
I'm gonna do compressions.
Back at the head of the bed.
1, 2, 3,
Waiting for
4.
something horrible to happen.
6 and 7, 8 and 9.
It feels very real to them.
Good job, good job.
And they're able to then focus on the patient and what did I learn and how did I do with my care for a patient and perhaps their family.
We are in Scaife Hall. Scaife Hall was built in 2015 after many, many years of fundraising and thinking about creating a space for the School of Nursing and Health Sciences so that we can all be together. It also has the RISE Center. RISE stands for Research and Innovation and Simulation Education. It offers a safe environment to practice, to make mistakes here with our mannequins or with our actors or with our standardized patients so that we can improve training for our nursing students and we can change the face, the future of nursing education. We are small, we are innovative, we are nimble. We're responsive to what's going on in healthcare.
One of the things that's very different about this program is our use of simulation. We use standardized patients who are trained actors. We allow our students to practice with these standardized patients on conducting psychiatric assessments, conducting social histories, coming up with a diagnosis and a treatment plan. We do this with teams of other health professionals. Our students are working in an interprofessional team so that everyone on that team is on the same page in treating that patient so that we can ensure quality health care.
Whenever I first started, I was deathly afraid of it. They were a little nerve-wracking. However, over time, they did prepare me for going out into the clinical setting and working with other mental health nurse practitioners and psychiatrists.
We're seeing a change in the healthcare model. We are seeing less patients in the acute care hospital and more patients being cared for out in the community. That's driving the need for more clinicians in the community. So our nurses learning this role of health coaching is very important. It's an essential part of the healthcare team.
When you think of nursing, you think of being in the hospital and caring for a sick patient, but with the health coach side of it, you're in the patient's home, talking to the patient, getting to know them, understanding them as a person, not just a number.
When we are looking for a university that's more innovative and more flexible, we almost always go to Robert Morris. They've always been one of those universities that are interested in taking things to the next level, doing things that are more cutting edge.
So when you're approaching the shoulder, palpate the clavicle until you get to the end.
We provide that hands-on clinical skills. The number of different workshops that we provide the students, give them that opportunity to practice those hands-on skills. The alumni rave about the fact that we have those clinical hands-on skill workshops for them. I was looking at ways to bring real-life situations to our health administration students. Root cause analysis following a serious or sentinel medical error is the topic that we chose. This exercise was extremely innovative, and I don't know of any other universities that are using simulation in this manner. You always think of simulation as being at the patient's bedside, but this is actually bringing healthcare professionals together and simulating an event that happens in the hospital.
This is one of the first times that we have really married findings from simulation with findings in the clinical area. Being able to marry those two things together, to be able to spend more time as a clinical faculty member with those people who really do need more time from me as a clinical instructor, identified by the simulation faculty, is a real gift. I think that is one of the most novel and innovative things that we're doing here at Robert Morris.